first thing they're going to say is which will be the first tube that you are going to collect if all the tubes are ordered. Blood cultures. Back in the days, blood cultures were collected on an sterile yellow cap tubes. Not anymore. As you can see, now we have different color code tubes. This is blue. This is like burgundy. It can be like brownish. It can be spotted. Red.
It could be spotted?
Right.
Okay.
So these tubes, and they are large. Some of them has the neck really long, like those ones over there, because those we can use it directly using these adapters, like the ones that we use to collect blood. For these ones, we have to use different adapters because the neck is very short. So whenever you encounter something like that, these regular adapters that you use to collect blood are not going to be the correct one. It's going to be another one that is very wide because it's got a fit right in there. But you will learn when you are there. The most important thing is that you understand that these are blood cultures. There are two of them. You learn about them? How do you collect these tubes?
These tubes.
The culture.
We didn't learn about those. This is our first time seeing that. That's why we want you to go over for like again.
Okay,
that was our first time.
so these tubes are blood cultures. They are the first one that should be collected from the patient. They have different colors for reason. What is the reason? We have one is blue. These have oxygen inside. Is that understood? This does not have oxygen inside. This, when you collect blood, the blood is the microorganism, because these blood cultures, as the word implies, is to do a culture. Blood culture to determine which type of bacteria. This is for bacteria. What type of bacteria has entered the bloodstream of the patient? So the patient don't have an infection on the outside. No, it is inside the blood. It is called septicemia. And right, and you have to know this because it's going to be on your exams when you take the phlebotomy exam.
How you spell that?
Thank you so much.
No problem.
We would have been in front of that test like septicemia. Hey, teacher that.
Septic. Remember, it's something that is septic means it's dirty, it's contaminated. That's what we said, aseptic technique, right?
My friend had a
Aseptic, no infection. Septic
It had a septic
has infection, correct. And if you have an infection in the blood, it's called septicemia because it's infection, emia, blood. And it's usually a bacteria. So how do we know that the patient has that? Well, first we're gonna check the symptoms. So when you see a patient, if you see a question when they tell you, this is a 25, 30 years old, 50 years old patient, comes in complaining about fever, but he takes medications to lower the fever and it doesn't lower the fever. The fever keeps on spiking up. So fever that does not go down, does not slow down after giving antipyretic medications for fever, it means this patient has an infection inside the blood. Is that understood? That's called septicemia. So the questions are, we're going to ask you, which will be the reason why you are going to collect blood cultures? Patient has septicemia. What is septicemia? Infection in the blood. That is basically what it is. Now, if you see, we have two bottles. These have a chemical inside. These have an anticoagulant. All of these have anticoagulant. It's called SPS. This is how it's known. So these tubes, if you read the label, it's going to have a chemical inside that is called SPS. And that is an anticoagulant. Usually they lie to us that. What is the chemical? What is the additive? What is the anticoagulant inside the blood culture tubes? SPS. Don't even bother trying to know what each letter stands for, because they just give you the acronym. It's a lot easier. So now, why do we have those two tubes? This procedure has to be done first if it is ordered, and the reason behind this is because, remember, this has oxygen, this doesn't have oxygen. Why? Because we have bacteria that grows in the presence of oxygen, and we have bacteria that does not survive when oxygen is present. So let's say that I have a patient who has caught a bacteria that does not survive in the presence of oxygen, and I only collect this. Am I going to have it?
No.
It's going to go here or here. It's going to die. We're not going to see it. So for that reason, we're going to have a tube with a special chemical inside, preservative, that is going to prevent that bacteria from dying, so we can see it when they analyze the blood. Now, this has an order. You should not just pick any tube. It says, oh, I like this, so I'm going to collect this first. Oh, I like this. Well, the one that has oxygen has to be collected first. The one that has oxygen needs to be collected first. The second one is going to be this tube. Now, there's another trick for this. Usually, these tubes are collected separately. You cannot collect these tubes from the same vein at the same time, like with these little tubes.
Yeah.
That you get one and then pass one. No. These ones, you have this, you do it from one arm, this you do it from the other arm. And any other tubes follows the second tube, because there is always going to be a set. A set means more than one. In this case, there are two. If the doctor ordered cultures, you have to have both. And if the patient is very sick and we have to do it over and over, the doctor can order 2 of these, another set, 3, 4 sets. Is that understood? Because we are going to check. Because if this patient has septicemia, this patient is not treated, this patient is going to die in 48 hours. So we don't want that, right? So we're going to run this as soon as possible. And we're going to try probably to give the patient some medications empirically. Empirically is, before we get the results, we give something that we might suspect the patient needs, that might work for while we receive the results. So remember, the one that has oxygen goes first. Now, if it has oxygen, they don't tell you it has oxygen. It says aerobic, anaerobic, aerobic. Write it down. Okay.
They sound like the same word.
Yes,
With the I,
yes.
with the A.
It's just done a little kind of 1 or 2 letters. See? Aerobic. This is an E. Anaerobic. So this have O2. This doesn't have O2. So I'm gonna cross it.
The oxygen.
Yeah. And which one would you collect at first?
The oxygen.
The oxygenated one. See, that's the reason why I brought my stuff, because I have all this because I do my courses. And I want to make sure that I show you the right thing, you know what I mean? Because if I don't show it to you, or I don't even mention it, you're going to be lost. So back in the days, there was only one tube, and it was color, yellow color. Unfortunately, these exams have not updated anything. The tube have changed like over 20 years, but the question is still the same. So they still use yellow sterile, but read as sterile, because there is another yellow that is not sterile.
That's what was confusing me.
So when they talk about cultures, you look for yellow sterile. That's the color code. Unfortunately, they're not going to mention this. They're going to mention aerobic and anaerobic. And what is the yellow? It's only one, supposedly, right?
Yeah.
It is a set. So that will be the first one. It says right there, see? Oh, I have it right there, SPS, blood cultures. These tubes, because every single tube that you have except for the red, in the red that is glass, the glass doesn't have anything inside. So because it has anything inside, the red that is glass. Because if it is red plastic, that has an additive inside. This doesn't have anything. So therefore, if it doesn't have any chemical, any additive, any preservatives, when you collect blood, you don't need to invert it.
Okay.
So they're gonna ask you, which of the following tubes you do not invert?
Red glass.
Look for the red. Because sometimes they just said red. Okay. But if they said red
with no
red
additives.
plastic or red glass, then immediately, if it is glass, but in your questions, believe me, it's gonna say just red. So if it is the red, you don't have to invert the tube. Because what is it that you're gonna mix? There is nothing in there. You mix the tubes that contains additives or chemicals inside. Other than that, you don't invert them. And usually, because these are kind of exceptions to the rule, they like to ask these questions. And I like to tell my students so they get it right.
Yeah, we didn't know that.
No? How's that?
The teacher was teaching us stuff
He kept telling us to disinvert.
Okay. So now you know cultures first. But remember what I said before. In order for you to be sick, that you have like 48, 72 hours to live if they don't treat you, you're not at home chilling. You're not going to the doctor's office at all. You are hospitalized, whether you are in an emergency or whether you are in the ICU. So usually these cultures, you don't have to collect it in your office because this is in serious situation. You know what I mean? If I'm very sick, how long do it take this blood when you go to the doctor to get the results? 2 weeks, sometimes a month, sometimes they never call you. Well, your patient is in life or death situation. So this gotta be done fast. 2, 3, 4 hours maximum, you have to have this. So that I can start treating you immediately. So usually they don't order this on a regular basis. Now which one will be second?
blue.
Light blue. Because we have dark blue. See? This and this is very different. So light blue. Always pay attention. Fortunately, they don't tell you dark blue, light blue. They don't want to confuse you. They just said light blue. That's it. Now, what is the chemical inside the light blue? Sodium citrate.
Oh, I said
Listen.
citrates.
Oh no, you can pronounce it that way. Yeah,
Citrate?
citrate is correct.
Okay.
See?
Sodium citrate.
Right. If you are in American English, you said citrates. If you are the British English, you said citrate.
Okay.
It's understood. I always use citrate, but then lately I'm using citrate. So no worries, it's pronounced correctly. So this tube, all these things that I'm going over, you're gonna have it in your exam. Particularly if you take phlebotomy, everything is gonna be asked. So light blue. What is this test so? What is this tube so particular? Because this is the only tube that you're gonna have to fill all the way until right here, this mark, this little arrow. So the tube doesn't fill all the way to the top. Because what is it that these tubes contain inside? Anybody knows? Vacuum. This is like a vacuum, like the vacuum that you use that suctions the dirt and whatever else. So that's what it is. When you put the tube, the needle right here from the vein, it suctions. This suctions the blood, and that's where you see blood entering here. So sometimes if you don't see blood entering right here, there are two things that you have to think about it. Which ones are?
Maybe
Or
the needle.
there is no, that's one. The needle is not inside the vein. If you're not inside the vein, there is no blood gonna come here. Number two, that
vacuum.
there is no vacuum.
What happened to the tube with when we did the arms?
It happens a lot. Now, why is it that these tubes loses their vacuum? Anybody? Yeah, you have to use it on once. Yeah. If you pinch it and then remove it and try to, no, it doesn't work anymore. So this will be, so what will be the reason why this tube will lose its vacuum?
It was already used.
No, it is brand new, or I have it right there without using. What will, remember, every single tube have an expiration date. These are questions for the exam. When they have expired, the vacuum is over.
I didn't know they had expiration date.
Yes, we have expiration date. That we don't have a number.
Is it on the packaging? Or
It is right here in each tube.
Okay.
I'm gonna pass tubes to you, and you're gonna read what is it. Here it says sodium citrate, and it says what is good for. What is it you're gonna do with this tube? So lots of information around here, and it has a label there. Fortunately, now you don't have to write on the label because it's too small. Now we have pre-printed, computerized labels, so just be prepared to place them. So that's basically what it is. So these are all questions for example. What is this tube used for? What is the analysis? What is the test? What evaluations are we doing when we collect these? Coagulation factors. When we need to know whether your platelets or thrombocytes, these cells that causes the blood to clot, they are clotting at certain time, that you're not gonna bleed to death, or that it is too thick that you're gonna die also. So coagulation. This is for coagulation factors, yeah. So whenever you see tubes for coagulation, light blue,
So you
no
know
other
people
tubes.
that bleed a lot, like when they get a cut, that's what they would.
We collect blood to see how long it takes your blood to clot, because your
Okay.
blood needs to clot between 3 minutes to 11 minutes. If it goes beyond 14 minutes, you have a problem. That means that you can bleed profusely. But mostly simple, light blue, sodium citrate, has to be full, completely full, this tube. You cannot just collect half of it, 3/4 of the tube is gonna be rejected by the laboratory. You have to collect enough. You have to go all the way until this little arrow, that is where the label ends. You don't see more blood coming in through the tube, but you see that it's only half. This tube is not good. It's losing its vacuum. So for that reason, you have to get another tube and fill it up. You should not mix two tubes. Oh my God, I need one tube full. Because we try sometimes to be smart, right? I know you guys, and I know myself. So I get two of them. Oh my God, half and half. Let's put it right here. I open this. Isn't it that we do that? Yes. So don't ever do that, because these have a different concentration. This has a different concentration, and the quantities are not the same. So when you mix it up, you probably have more or less chemical compared with the amount of blood. For that reason, we have to fill it all the way up. So be careful with that. Most of the tests that we do there, you're gonna see this: PT, ETT, PT, INR.
What's that?
This is an international ratio. This is for people who are already taking Coumadin or these blood thinners. So anytime that the patient goes there, we need to know that their blood is not too thin, but it's not getting too thick. Remember, it's very important. If your blood gets thick, it gets stuck in the blood vessels, and we have a stroke, a heart attack, a PT, a pulmonary embolism. So you don't want any of those. This is very dangerous. And if it is too light, it's not clotting enough, you're bleeding inside. Somebody touch you like this, and you develop a bruise. So, and these people will bleed inside. So be careful with all that. So this will be the test. When you see PT, because this is think about P, platelets. And then you say, oh, platelets. Oh, those are the cells for coagulation, the one that clots. Immediately. I always use this to remind myself. Remember, platelets are proton beam. This is mean proton beam time, proton beam partial proton beam time, and so on and on. So that's basically what it is. So just know those things for you. So when you see them, you're not like kind of lost. Because you're going to get questions when they say, okay, the doctor ordered CBC. Have you heard about that?
Yeah.
PT. Metabolic panel. So you need to understand what is this, because you need to know which color that tube you're going to collect, and they're going to ask you what is the order. What will be the first tube that you collect here? Which will be the first test? PT. Remember, PT is blue, and we don't have, this is the first one. And which one will be the second one? MP, metabolic panel, because this is chemistry. See? Blue, chemistry, and then the rest. CBC is right here, blue, purple. So we need to understand how that works. Because remember, one of the things that you're not going to find when in the requisition form is the order of draw. You're going to find the color of the tubes, the name of the test that the doctor orders, because the doctor is going to check it out, and you just have to follow along and say, oh, light blue, LB, lavender, L. So then you say, oh, that's the one that I have to use. But it's not going to tell you what is the order. You have to follow the order. And the order is right here. See? This is the order. These are the tubes that you have to follow the order religiously. So if you don't follow this order, remember it's going to be contamination. Oh, I like yellow. And you collect this first and then collect this one. This has one chemical, this has another additive. If I mix them, because when you put the needle in there, the needle gets contaminated with the chemical inside. And I pass it right here, it's gonna damage this sample. And the laboratory is going to call your office and it's gonna tell you to call the patient and draw the blood again, because the results are not correct. So that's basically what it is. So we have blood cultures first, light blue, then red. Just simple red. Whether it's plastic or glass, it is red.
So that's how it goes always.
Always.
So what is the thing? What's the order?
Right there.
So yellow is not the first one?
Yeah? Look at here.
So that's
Yeah, but it's not yellow, right? You
So
missed
what is-
the part.
So what is that?
This is the blood cultures. You see the little bottles in front of yellow? These are the ones.
And what do you do with that?
That's for blood cultures. That's when the patient has septicemia. I went over it. When the patient has an infection, a bacterial infection in the blood, and my patient is about to die, he has 72 hours to live. If I don't discover what bacteria he has, gone. So I have to draw cultures.
And how you draw blood out of that? How you do the blood out of that?
Special.
You have, see these adapters that you use for the regular tubes? We have a different one, a little farther one that is gonna fit right here. Yeah.
I've never seen that. Okay, no?
Yeah, because this is not something that you're gonna be encountering, but you will definitely 100% will have it in your exam.
Okay.
At work, unless you work in an emergency or ICU, you will have it. And most of you are not gonna work there, because most of you are gonna be working in an outpatient clinic. Because most of these places, they hire nurses. It's a serious condition. Remember, you have to be there night shifts and things like that. So it's not easy. So as you can see right there, now this is not yellow. Don't think that this is yellow. It looks like a yellow, but it's not. It's gold, which is this. See the difference? So red, remember the red, we have one that is plastic, one that is glass. But it's the same. It's just that we are replacing plastic, glass for plastic. because glass is very dangerous. If this drops in an office, we don't have carpet. That's dangerous. Can you imagine? A needle falls into your carpet, blood drips into your carpet. How are you going to clean that? So usually we have floors, like hard, heavy-duty floors, right? That can be cleaned easily. So if it falls into the floor, it's going to break. So this glass has been already changed for plastic. But because it's plastic, you have to have a chemical inside. And what is the purpose of having a chemical on a plastic? Red. If this doesn't have, because the blood in the glass doesn't stick to the walls. Versus in the plastic, as soon as you draw in blood and then you mix it, the blood is going to stick to the walls. And I'm not going to see the amount of blood. I'm not going to see anything. And when I process it, I'm not going to see the liquid part. So that's the reason why the plastic has a chemical, which we're going to mention later on because it is right here.
So either or is after light blue. So either the red or the plastic?
The red comes in plastic, in glass.
Not the red or glass. Either the plastic or the glass comes after light blue?
Yes.
Okay.
According to here, see, they have it mixed up, but no, it's not like that. So just think down the red. Now, the reason why they put this first is because the red is usually not used much because it's for special tests. Is that understood? So, in this case, they try to put the other ones that are used the most. Now, these two are identical. See? The only thing that changes is the color. Don't see the color. See? What it has on the bottom? Some type of glue, right? Mm-hmm. It looks like glue. Well, that is called serum separator tube. Because these tubes are identical. It's just different manufacturer company. This was, back in the days, the only tube that we have for chemistry tests. Then the competition came over. Now, if your office has this one, they don't have this one. Is that understood? It's not like you have to have this and you have to have this, or they're going to say, oh, gold. No, if you don't have gold, these two tubes are called SST. You heard about that, right?
Yes.
SST. What SST stands for?
Serum separator something.
Correct. Serum separator tubes. When these tubes we collect blood inside them, is the same. If you use this in your office, they buy this, you're only gonna be seeing this. If your office buy this, so only you're gonna be seeing this. You're not gonna have both. Is that understood? So these are in the same category, if you will. And you see, they come in the small ones. Why? Because these tubes holds a lot of blood. This is like 8 to 10 milliliters of blood. Whereas here we have only 3 milliliters of blood. So if I don't need too much blood to do a test, what should I collect all these? And these tubes don't need to be filled up. Remember, the only one that needs to be filled up is this one. The other ones, if you have half of it of the tube, you're fine. Is that understood? Mm-hmm. So that's basically what it is. So these tubes are the same. Now, what happened with these tubes? What happened to this glue right here? It's called serum separation tubes because when you put this inside the centrifuge, the machine that you learn how to use, that you put the tubes there and then you turn it on and then you put at certain time, certain speed, and it starts spinning around, it separates the liquids from the solids. Now you're gonna be seeing a little part that is kind of yellowish, very clear. Exactly. So these tubes in particular, when you do that, this glue melts and sticks right there in the middle and separates the solids from the liquids. So if accidentally this tube falls off like this, or you invert it they're not gonna mix. Whereas this one, everything else, because it doesn't have this, you have to keep it all the time upright. Because if you do something like this after you spin it, it makes it up again. And guess what? The problem is that you cannot spin it again. These tubes can only be spun once. Question for the exam. How many times can a blood tube be spun? Only once. If you do it twice, you already hemolyze all the blood. You kill all the cells.
Are you talking about when we invert it or when we put it in the centrifuge?
No, in the centrifuge.
Okay.
Every single tube needs to be inverted 5 to 8 times.
So what you mean?
When you draw the blood,
Mm-hmm.
you have to do it like this. That's inversion.
8 times.
Because you have 5 to 8.
5 to 8 times.
So remember, all these tubes has chemicals. This is a clot activator. It is chemical. So you still have to invert them 5 to 8 times. So these tubes, these 3 tubes, you only can collect 0. See? Zero separation, zero separation, zero separation. So these 3, see, the ones that I have right here, is only for 0. So the doctor will tell you, this color, this color, this color. You know that is for 0. Versus everything else, any other color, including this, are plasma. The liquid is going to be plasma. Why? Because every single other tube besides this is going to have anticoagulants. And anticoagulants is an additive, a chemical that doesn't allow the blood to clot. And if it doesn't clot, the blood in these tubes, these nice colored tubes, except these ones, the blood doesn't clot, even though if you keep it for a year, 2 years, it's like the blood that runs in our system. They don't clot because they have a chemical that doesn't allow this blood to clot. That's what is called anticoagulants. Okay? So, once again, the good thing about these tubes is, like, usually these are the ones that you have to spin in your office. If you have to send it to an outside laboratory, you cannot spin this, because when you send it, they're gonna move and they gonna mix again, and you cannot spin it again. Well, you can spin it, but the results are gonna be false positive or false negative. So that's what it's. So now you kind of getting a little understanding, right?
I'm confused in the spinning.
Huh?
I'm confused in the whole spinning.
Don't worry about that. We're gonna get to that point when we actually do it, practice. So now let's go over the order, because it's like too much information that I'm giving you now. And so we just go for the order. First blood cultures, then light blue. Then we're gonna have the gold or speckle. This tube, usually they call it different names. The real name of this tube is SST, the same as this one. But then they call it gold because of the color, because these are color code. And this we call it red and gray. Is that understood? Red and gray. But when you look at these tubes on the requisition form, look for SST, because this is the zero separation tube, right? If it is red alone, then you have an R right there. So that basically, but this will say SST or gold tube. So that's basically what it is. This is also known as speckle. This is also known as tiger because of the 2 little spots right there. So people call it different names in the office. So get familiar with it. I remember, I will never forget these tubes, because a doctor, when I started doing my internship, the first 2 days, because they hired me after that, I thought they were going to fire me instead of hire me. So the doctor says, Alberto, can you do me a favor? Collect me on speckled tube. I was like, First of all, my English was no English anyways. To know this, I knew that this was SST because I read it over there, over the label is there, it's written. So he says speckle. And you know, when someone gives you an order, you feel kind of embarrassed to ask, what is that? And because you feel uncomfortable because they're going to assume that you know what you're doing, right? So I just keep quiet and I look for the other medical assistants that were there. And I said, oh, listen, that doctor over there asked me to draw something, but I don't know what it is. He didn't say blue, he didn't say red. He said something, but I didn't even know that started with S. I thought it was ES anyways. So he said, what is it? I said, go ask again. I said, oh no, can you guys go ask the guy? Because I don't even know how to ask. So he says, then the girl starts saying, oh, what doctor was that? That one. Oh, he always ordered an speckle. Ah, yeah, that's the word that he says. And then kind of I was relieved. Then just to make sure that I was going to collect, because remember, once the patient is gone and you collect the wrong tube, you're in trouble. So then I went over there, oh, doctor, you mean this one, right? SST? He's, of course, I didn't say it like that. I said, this one. He said, yeah, that's the one. I said, okay, no problem. So from then on, I learned that this was called speckle. Then I moved to another department, and they call it tiger. And they were saying tiger. I was like, you gotta be another word that sounds like the animal, but it's not. That is that one exactly because it has like the speckles right there.
How you spell that?
Tiger,
No, the other one.
speckle, like the speckles. Okay. Speckle. I'm not really sure. Speckle. I think that was like this. It's either or. One, no, I don't recall exactly. But that's what I call it. But as soon as you hear speckle, immediately you say, oh, I know what the guy's talking about. Because remember, sometimes the doctors, get used to, and they think that because their assistants, they know them, and they ask them to do, get me a CVC, get me a purple tube, or a lavender. Remember, purple, lavender, same. So then we're gonna move to the green. We have two greens, see, light green and dark green. So usually I don't want you to worry too much about this. I want you to learn the light green because that's questions for the exam. Light green is a tube that is used in emergency situations. So the question goes like that. Okay, you are working in the emergency department. Immediately, as soon as it says emergency department, you should be thinking about what? Light green tube. Because this is the tube that replaces this. This is for chemistry. See? Plasma separator, but it's plasma. But in emergency situation, this tube takes too long to be processed. That one is processed stat. You heard about stat? Yes? What does stat means? Origin, immediately. So they're gonna ask you two questions about the light green tube. Which of the following color top tubes you need to collect immediately? Start. So light green. Immediately. Because this is a person who is in an emergency situation. We need the results immediately. So as soon as the laboratory receives this, not only that we have to write down on the requisition form, we have to write right here in the requisition form, and we write start. You're gonna see all these. So that means that you have 10 patients to draw blood, and you come with this. This is the first one that you draw the blood. This is the first one that you send to the laboratory. Otherwise, this patient is gonna call you goodbye.
But we use light green to
Light green.
replace.
It replaces these tubes.
Oh. serum?
The serum. Because this is the only time that this tube is used for chemistry in an emergency situation. So that is the key. So what is the chemical inside? Heparin. For both of the tubes, the light green or the dark green, heparin is the additive inside. So remember that you need to know the additive, the color, so you can relate it, and some of the tests that you're gonna do with this. So that's basically what's important.
What is it that it has inside again? What it has inside?
No, she said what's the chemical that it has inside?
This one, heparin, is the same one as the other.
Okay.
These two greens, and you see comes the little one. So that's basically what it is. So these are the key for all these tubes, particularly for exams. When you're working, remember you're gonna have the requisition form. No worries. Because right there is gonna say what color that tube. What you need to follow is the order. That's basically what it is. After the green, you're gonna find the lavender. Oh, usually it's the purple tube. But for exams, usually they use lavender. Is that understood? This is very important because lavender, one of the most common tests that we do there is everything is about the blood components. Everything is about the blood components. It's a CBC, complete blood count. Here we're going to check red blood cells, white blood cells, platelets. Red blood cells contains hematocrit, contains hemoglobin, so sedimentation rate. So all that has to do with red blood cells, white blood cells, platelets. This is the tube that we need to collect. Every single time that a patient comes to the office, they draw this and they draw this. So get familiar with this. If they don't have this, they're gonna see this too because it's the same. But this CBC always they're gonna run it in chemistry because chemistry is to see how our chemicals in our body are. How is your sodium? How is your potassium? How is your cholesterol? How is your magnesium? Every chemical in our body, because our chemicals in our body, they lose balance. So we need to know how you're doing, even though if you're not having symptoms. And this one, to see how's your blood, even though if you're not having symptoms. So these are called routine tests. So always you're gonna have this. And sometimes this. So this will be like the three most common blood tubes that they're going to collect for you. So that's basically it. So that will be, and what is the chemical inside this lavender? EDTA. 100% you will be asked, because these are the most common tests that we run, the most common chemicals. This is one of those tubes that regardless whether you have symptoms or not, the doctor is going to order that tube. EDTA. Don't try to spell it out or anything like that. It's 4 chemicals together. So just look for EDTA because that's what they're going to give you, okay? It's a lot easier. So that will be for complete blood count. So let's say that they said, okay, the patient's, we're going to check the patient's hemoglobin. Which color top tube we're going to use? Lavender. We're going to check for sodium, cholesterol, glucose. Which tube we're going to do? Chemistry, chemistry, chemistry. Those are the chemicals inside our body. Is that understood? So it's different to say red blood cells, white blood cells, and platelets, or hemoglobin, or hematocrit. See? Hemo. What is hemo? Blood. Hematocrit. Hemo. Everything that says hemo. So you know there is blood. It has to be with the blood components. Lavender. That's it. Now we have the gray one. This is colored gray. Now, this tube also has been asked. Why? Because this tube we use it for two exams. One of them is glucose. But this is a glucose test because we do glucose as a chemical. But when the doctor finds out that the patient has elevated amounts of glucose here, we need to do glucose in this tube. But this time the patient is going to be fasting. What is fasting? Anybody knows what is fasting?
Can't eat at a certain time.
Okay, so the patient should not eat between 8 to 12 hours before the test. It's exactly like that. There is no other answer. Fasting means that the patient should not be eating anything before the test for a period of 8 to 12 hours. That's why we want our patients to come in the morning, because during night they don't eat, they just sleep. We don't want no extra sugar. And we tell them, don't drink anything. Maybe the only thing that can drink is water. But you should not drink anything because eat anything, because if they have breakfast, what was the purpose then? I'm gonna be seeing the extra sugar that you put with the breakfast, or with the coffee, or whatever you drank in the morning. So we want you to be in a basal state. That's called basal state, which you just woke up and whatever your body consume at night, that's the leftovers that you're gonna have. That's the one that I'm gonna check. Another test that you're gonna run in this tube is alcohol levels. When the police caught you driving and they suspect that you are under the influence of alcohol, immediately they do breath tests, right? But that is not reliable. If I see you a little kind of crazy, then I'm gonna say, oh, wait a minute. I'm gonna take you to the prison. They're gonna draw blood. They're gonna send it to the laboratory. And if this comes with the levels higher than the levels allowed, then you're in deep trouble. Now you are driving under the influence, DUI. Is that understood? So this is for that level, alcohol levels. So if I'm gonna check for alcohol levels, what is it that I shouldn't be doing when I'm collecting the blood from the patient? You are the one who's collecting. You're not the one who's being accused of drinking. So you are the phlebotomist. I come here, the police bring me here and says, check alcohol levels. What is it that you're not gonna do when you
Don't
do
use alcohol swipe.
Thank you. You should not use alcohol when you clean, because this alcohol can contaminate my sample. Just one little piece that enters with the needle can increase the levels of alcohol right here, and it's a false positive. You do not clean with alcohol. Then what are you gonna use instead? No, you don't use iodine. Iodine is worse than alcohol. You use chlorhexidine. They didn't tell you that? Okay, oh my goodness.
I'm telling you, I'm learning this all over. I don't know.
You can say that if you wanted to. It's not gonna understand.
How do you spell that, please?
Oh, you're putting me in a very tough situation.
See, now I'm looking at the order draw. I never seen orange or pearl. I never seen those. On the order draw, I never seen an orange tube or pearl. On the thing,
Yeah. No, in the order of draw, we skip them because they are not on the order of draw. These will be collected after the 6 that we mentioned. So we have like 100 color tubes, okay?
You must clean with what?
Chlorhexidine. Can you just Google it and tell me the right spelling? Because I'm not gonna know every single spelling, but it's like chlor.
Oh, okay, so it's CHLORHE
See?
XIDINE.
DINE. See? Chlorhexidine. I was on the right path. It's just too many things that you have to. But for you, you don't need to know it. Just to pronounce it well. And when you see the answer, boom. Chlorhexidine is used in replace of alcohol, particularly if you are collecting alcohol levels. Think about it. How am I going to clean with alcohol when I'm testing you for alcohol? That can draw a false positive. There is another time that you're going to use chlorhexidine. Anybody knows? When would you use chlorhexidine besides collecting alcohol levels? If you are allergic to alcohol. These questions comes in the test. How do you not know that? No,
Supposed to use something else?
yeah? No, iodine, you don't use it. No.
Oh, that's what she
Iodine,
said.
you don't use it. You don't use iodine. You use, hold on. You use iodine when you're gonna do cultures. Blood cultures, because the whole thing is different. But for regular blood, you don't use iodine. You messed up with all these results.
He said we use that.
That's what he kept telling us.
Well, remember in certain countries they use different things, but we're in America, and we're gonna do what they do here. So anytime that you see on your exams iodine, that is not the right answer, except if you are collecting this. Is that understood? Remember that iodine, we use it for septicemia when we are doing as an septic technique, when we're gonna clean wounds, when we're gonna do dressings and things like that. But for other things, no. So don't. Anytime they see iodine for your blood collections, forget about that. Look for something else. You look for chlorhexidine. Let's say that your medical doctor is so cheap, or you run out of chlorhexidine. What are you gonna do?
Nothing. Because I'm not getting nobody.
You let your patient die. Right. No. Listen up. Your patient is allergic to alcohol, but you don't have chlorhexidine. What are you going to do? With water, soap and water. You get a little gauze, wet it a little bit, and put a little soap, and then you clean. And then you get another one and you rinse. That is the solution. You have a patient who you're gonna do alcohol levels. You don't have chlorhexidine. You only have alcohol. No worries. Soap and water. Everybody sign?